Hi everyone, I'm Stephanie with 9 Health. Today we're talking about a topic you may have heard a lot about lately in the news and just all over, antibody testing for COVID-19, especially as we start talking about, reopening things slowly. It's definitely a hot topic right now. But what is this test? How do you get one? 9 Health expert Dr. Powell Coley is joining me, along with Dr. Ashley Fraser-Abel. She's assistant professor at University of Colorado School of Medicine, director of Xera Biolabs at the CU Anschutz Medical Campus, and Dr. Kevin Dean, also from the CU Anschutz Medical Campus. Thank you everyone for joining me today. So first, Dr. Coley, just simply describe what a COVID-19 antibody test is.
So there's two types of tests on the market for COVID-19. One is the nasal swab. That looks for active infection and it looks in the present. So really the people that are tested with the nasal swab are those that are symptomatic or in whom you think there's a high pretest probability that they have active infection. And that's looking for the genetic material of the virus. So it really only is positive in the time that you're infected. The other type of test is the antibody test, also called the serology test. And what that looks for is an antibody in the bloodstream. An antibody is a protein, also known as an immunoglobulin, that's basically a marker that your immune system has seen that infection before. And so that test actually looks in the past and it tells you whether or not you have had that infection before. And we're looking for an antibody called IgG, which usually starts to go up about day 7 to day 10 after infection. And as far as we know from other coronaviruses, it can stay up for upwards of a year, 2 years, or even 3 years, as it does with MERS. Now, with this particular coronavirus, we don't have enough information to know whether or not this antibody actually confers immunity. In other words, does it actually offer you some protection, and exactly how long it stays elevated. But as best as we can tell, again, using our knowledge from other coronaviruses that are close cousins of this virus, there does seem to be some sort of protection offered from the antibody. And it's also encouraging that people who give their antibodies to others with a therapy called convalescent plasma seem to actually offer those ill people some protection with their antibodies. So both of these pieces of evidence suggest that the antibodies may actually confer some level of immunity. So that antibody test really looks backwards to see whether or not you may have been exposed to the virus and have protection against the virus. And in that way, it allows us to know kind of who is a little bit safer in terms of getting back out to their normal lives and less of a risk to themselves and to others.
Okay, thank you for providing that detail. And if anyone has questions, please post those in the comments. We can get those answered by our experts. Dr. Fraser-Abel, can you talk about the work that your lab is doing? Again, you're the director of Xera Biolabs at CU Anschutz. Talk about the work your lab's doing in relation to the antibody test for COVID-19.
Yeah, so I run an immunology lab at the University of Colorado campus that does testing. And so we're working with the entire serology group, which is a great collection of people on the campus looking at this from different angles. So my lab, in conjunction with the University of Hospital Lab and the Children's Hospital Lab, are working together to look at what's the best kind of testing we can bring onto the campus and bring that forward. So really, it's a great collaborative effort that I'm representing today.
And I think my internet's breaking up a little bit. Dr. Coley was kind of breaking up a little bit, and so is Dr. Fraser. Hopefully things improve on my end, but this is the world we're in now, and maybe there's a lot of people using it right now. So let us know if you can't hear us, if you're having trouble hearing us. Post your questions in the comments and we can get those answered for you. Dr. Dean, is there anything you can add to what Dr. Fraser-Abel said? How are you guys kind of working together? I know we've talked to you before. You're a friend of 9 Health, and we've talked to you before about rheumatoid arthritis. So how do you kind of fit into all this?
Yeah, so I am an arthritis specialist, but you'd wonder, well, why is he talking about COVID? So some of my other research is looking at population-based screening efforts for arthritis and other things that actually can help out here, because we're looking for ways to understand how COVID is affecting the population. And as Dr. Ashley Fraser-Abel said, I am not only the only person working here. I'm part of a big team of experts in ID, public health, and other specialties who are working together with Ashley Fraser-Abel and other people across the state to understand how we can mobilize testing, understand how this virus has affected our society, and importantly, translate all that into getting us back to work and understanding who's protected from the virus and ultimately how to treat it.
Great, I'm gonna hide my video and see if that helps our connection a little bit. Dr. Coley, this weekend, the governor's stay-at-home order expires. We're moving to safer at home. Do you think it's wise to start reopening without this widespread antibody testing available yet? Talk about, I guess, availability and, moving forward, what things should look like.
Yeah, I have significant concerns and hesitations that without the widespread testing in place, and of course the contact tracing as well that we've talked about, it may be a little bit premature for us to be transitioning at this point. And the main reason is because I really think of testing as a beacon of light. It tells us not just where we've been, but basically where we need to go, because it tells us about what the virus is doing at any given point in time. And models are great, we rely heavily on models, but at the end of the day they have a lot of assumptions and they are just models. So by having widespread testing, we actually are using real life data of what the virus is doing in order to guide our decisions. And just as an example, Governor Cuomo in New York has employed surveillance screening with the antibodies, and just today he reported earlier this morning that 14% of New Yorkers were testing positive for the antibody. Now, assuming that the tests that they're using are relatively accurate, I think that's pretty dramatic. And I think it helps us to know how many people may have already been exposed and how many are still at risk moving forward. And so my hesitation with transitioning from the stay at home to the safe at home order without having the capacity to ramp up the testing, it's pretty scary, because at this point, even those people that are symptomatic can't necessarily have ready access to a test. And as we start relaxing social distancing, we know for a fact that the number of cases are going to go up, because part of what's keeping the cases in check is our behavior of distancing. So if we do that without having the testing in place, we're actually not going to know that people are getting sick and that the virus activity has gone up until we start having people getting sick or, showing up at the hospital, or worst case scenario, dying. So I have significant hesitations about that. And I really want the message out there to be, this doesn't mean it's life as normal. This means we need to continue to aggressively socially distance, because that is our best weapon at this time, especially since we don't have the rest of the ducks quite lined up.
That all seems a little backwards right now. I think everyone's obviously anxious to get back to normal, but we need to try and do it slowly and safely. Dr. Fraser-Abel, I want to have you talk more about the antibody test, why it's important, and someone did just ask, how is the test administered? Can you talk a little bit about that?
Yeah, as Dr. Coley mentioned earlier, there are two types of testing, but then even in the serology, there's two types of the antibody testing. There's some point of care type testing, which would be a finger stick, and then there's ones that would be run in a core laboratory such as mine. So in the core lab, it's going to take more time and be more complex, but as you might guess, if you get fast in a point of care test, you also give up some of the sensitivity and specificity you can get in a more complex test. So for the finger stick or point of care, some of those have done really badly. I don't know if you've seen in the news, there were some incidences in the UK and in Italy where these point of care tests were performing very, very badly, like 30% of the results were wrong. So we have to take those very carefully and test them. And I know the state's working on some of that, but that would be the easiest test to get. So it's just going to be a pinprick and then a drop. Think of it like if you've ever seen a pregnancy test, it's going to be very similar, that lateral flow type point of care test. But as I say, we give up some sensitivity and specificity for that ease and speed. The tests that we're working on more on the Anschutz campus are ones that would be what we call an ELISA. So it's going to take hours instead of minutes to actually run it in the lab. So it's going to take more time to get results to you. That's similar to what National Jewish is rolling out tomorrow. They're on an ELISA style test versus a point of care. So those are the two really that we're looking for in the antibody tests. And I think once we get these out in large groups and in labs in Colorado, we can look at those epidemiological questions like they're already looking at in New York. How many people in Colorado have been infected with the coronavirus? We don't know those numbers right now.
Right. I think I saw yesterday, the state was saying, there's over 10,000 cases, right, Dr. Coley, but it might be 6 or 7 times that, just because we haven't been testing as much as we should be, it's not available to test. Dr. Dean, can you talk about the accuracy of tests? I know that I've seen out there, you Google it and it seems like you can buy an antibody test anywhere, but talk about the accuracy of, different tests. I know there were some coming out of China that weren't as accurate. Can you just touch on that a little bit?
Yeah, just echo what others have already said on this event here. We basically want to have very accurate tests for COVID so we can do two things. One, tell people accurately that they've been exposed. And the next part of that is make that result meaningful so they know what that test means in terms of their own safety and protection down the road. Because we don't want to tell people, oh, you've been exposed and be accurate, but then not also know part two to that, which is, what does that mean for your health? i.e. I'm now immune, so I'm pretty safe from the virus going forward, if that makes sense. So accuracy is just a critical part of that. And blood tests are tricky. They take a lot of years to develop a lot of the blood tests that we get all done commonly. And there's a big rush here around COVID to get tests out there. And certainly we understand the need, but we want to make sure we're doing it accurately as possible so that we're giving people great information. And as Ashley Fisher-Abels has talked about, understanding how accurate those are. Is it picking up people with the disease? Is it making sure we're not accidentally picking up people who don't have the disease and telling them they have it, or picking up another related infection that's really not the COVID-19 that we're worried about? So accuracy is incredibly important. And what we're seeing now is, I think our country and the world is actually mobilizing on how you get these accurate tests done and produced on a scale so we can test everyone that we want to.
I think that is the goal, to get as many of us tested as we can and make it as widely available as we can, which CU Anschutz is helping by developing a test. Dr. Coley, someone did, you all might be able to answer this, but someone did just ask, if you test positive, can you donate plasma? I think you touched on donation a little bit when we first started talking about it, but Dr. Coley, maybe I can start with you to answer that one.
Yeah, so this is in reference to a therapy called convalescent plasma or convalescent serum. And essentially what it is taking the antibodies out of somebody who's been exposed to the virus and injecting them into somebody else who is ill from the virus, usually critically ill or at least hospitalized and seriously ill from the virus, in order to help that person's immune system fight the infection. And this has been relatively promising in preliminary results. And in the Journal of the American Medical Association, there was a case series of 5 patients who all did very well after receiving convalescent plasma. And there have been numerous incidental reports here and there of additional patients, including in our own state of Colorado and at CU, who have recovered after receiving convalescent plasma. So certainly that is one of the other advantages of the antibody testing. Not only does it tell us where the virus has been and potentially, where we need to go to contain it, but it also tells us and helps us identify people who are potential targets for developing this therapy. We are in a time right now where there are no therapies for this infection, and this is one of the more promising ones with a relatively good safety profile. So the risks of that therapy are relatively low, aside from the risks of a usual transfusion. So this is definitely something that the antibody testing could also help us with, is to identify these types of donors. And the fact that this therapy seems to be working as a therapy also again suggests that these antibodies probably are doing something and conferring some degree of immunity.
I'm just looking through some of the questions we're getting on Facebook. Someone did just ask an accuracy question, so maybe Dr. Fisher-Abel, I can have you answer this. What level of accuracy for antibody testing is required for a test result to be useful? And is there different levels of accuracy? Maybe you can just talk about accuracy once again. I'm seeing what else this question says. Test results to be useful for guiding changes in test subject behavior. It seems false positives could lead to some bad changes in behavior. So are there different levels of accuracy? Maybe just talk about accuracy again.
Yeah, so we really separate that in 2 ways. We talk about it as how specific the test is and how sensitive. Now, how sensitive is, are we going to pick up people who are positive, who have seen the coronavirus? I think it's, the second question that can be the most critical and kind of gets to this person's question. If we're telling you you're positive, that you have the IgG antibodies, that you've seen the coronavirus before when you have not, you could change your behavior, go out without a mask on, go do things, with other people and expose yourself and then end up in the hospital based on that result. So it's very important that the test is very specific. So it's telling people exactly the right answer. Yes, you have the antibody or you do not. So when we talk about that in the lab, we want over 99% specificity, and that's difficult to achieve. So it takes really working at the assays to get to that. But it is such a key point for this test because it can be so dramatic if you get that wrong. On the other side, when we're looking at, is it really picking up just this coronavirus? So, we have 4 coronaviruses that circulate annually and just give us the common cold. They're not COVID-19, they're not SARS-CoV-2. So we have to make sure our test is only picking up the virus that is of an issue right now in this pandemic and not the other ones. So it's 2 pieces that we need to do. And on both sides, it's important. But I think really on the one where we're not giving you a false positive, it's actually more critical at this point. So, in numbers, I would say above 99%, but both of them are important if we're really going to use these tests in the major scale.
We're getting several questions on Facebook about availability. Are the antibody tests available right now sensitive to the specific SARS-CoV-2 virus? Someone tried to get an antibody test at National Jewish and they were already sold out. And then someone had asked, if you already had the virus, where can you get a test and then donate? Dr. Coley, maybe you can talk about test availability a little bit and what you've heard.
I think test availability has been a challenge, and there's been 2 reasons for that. One is kind of, the accuracy of the tests, as we've talked about, over 90 tests out there. All of them are not performing as they should. And so you really want to make sure that the test that you're getting is accurate. And then the second is something called supply chain disruption, which means that you not only need the test kits, you also need the reagents and other supplies to run the tests. Now the nasal swab tests are more sensitive to the supply chain disruptions because of those Q-tips that you need to collect those samples. Need to be special Q-tips. They can't just be regular Q-tips from the department store or grocery store. So that's important to keep in mind. They have to be ordered from a special manufacturer, and they're only made in, kind of small companies around the world that are having some disruptions. The antibody test is a little less sensitive to that because it's a blood draw with, fewer of those reagents, but certainly the reagents needed to run the ELISA are also something that could be sensitive to those disruptions. So that could explain some of the limited access to testing. We are getting some testing from South Korea, as the governor announced yesterday, 150,000 tests coming into the state. And I think 20,000 nasal swabs are also coming in order to improve some of that access to testing. Now, National Jewish, I know, is offering a direct-to-consumer model where you can come in there without a doctor's note and request a test. If you're paying out of pocket, it's $94. And that may be one of the reasons that they have had a higher supply than they have a demand. But I'm not entirely sure if they're expecting to ramp up their supply later. But I do know that it's an ongoing challenge for our state to really get the people tested that need to be tested, that want to be tested, and the ones that should be tested.
And Dr. Dean or Dr. Fraser-Abel, I'll let either one of you answer kind of how close you are to your test from CU Anschutz, your antibody test that you're developing, how long that process kind of takes, just as we're talking about availability.
Well, that's really hard to predict because we are experiencing some of those supply chains. So we're looking at some other avenues that I think are very promising to get actually a test up that really can be extremely specific for us. So we're a couple weeks out there. I'm sure CU will let you know when we're at that point. But we are seeing the testing at the large reference laboratories now. So the Mayo, the ARUPs are now offering that testing. And I think you're going to see that increase exponentially, the number of places, including on our campus, that will be offering that test in weeks. Timeframes in post-COVID are much faster than timeframes were before. So we're really moving as fast as we can to get a test that we really can believe in available.
And then while we're talking about all that, 9Health has kind of been working with CU a little bit. Dr. Coley, maybe you can just talk about what 9Health is working on as far as partners when we're hoping to offer a test. But again, it's the availability of that test and working with these partners. Can you just talk about what 9Health is doing?
9Health's mission for the longest time has been prevention, education, and community service. And I think in keeping with those 3 tenets, we're really trying to partner with someone like CU to try to provide, widespread education to the community about who should be tested and how they should be tested, to provide access to these tests, and particularly try to provide this access in rural areas of the state where they may not have ready access to the tests from other facilities. And then, to finally try to provide a community service by helping engage with a partner in widespread testing so that we can really determine, what percentage of our state continues to be at risk and what percentage of people can maybe safely start to return to work. So it's a really noble undertaking, and I'm really excited about what it could do for our state, because I think if we carry out the testing in the right manner, 9Health along with CU and other partners could really make a huge impact on how we recover from this pandemic.
And then just looking through questions. Yeah, go ahead, Dr. Dean.
Well, I wanted to chime in before I forget my train of thought. I think one of the callers had a question that they might have been infected by COVID and were wondering about something. If I can speak to that person, at least in some angle, because this virus is new, because we're developing new tests, and we actually need people who have been infected by the virus and recovered to help develop tests and actually understand how the virus develops and how people recover. So I don't have a specific research study for you now, but if you have been infected by COVID and that's been proven, you're going to be very valuable to the research community here in Colorado. So I would just say, keep your eyes and ears peeled for learning more about research projects that you could potentially participate in. Certainly, I don't want to coerce you into joining those things, but just know that you're going to be very, very valuable person to the research community in the state of Colorado, either at the university or beyond that. So just keep your eyes out for research that you may be able to participate in, and think about that if that's a good fit for you.
Yeah, I think that's a good point. And people are asking, if I've had it, where could I donate plasma? They do want to help those that have survived it and want to be able to help with this kind of stuff. Dr. Kohler, there was another question on here that I think that you could answer. And again, we talked about this at the beginning, but someone did ask, if you have the antibody, do you retain the ability to be contagious in the future? So talking about, are you immune if it's been shown that you have the antibodies?
So, this is a brand new virus, and we have very short-term data on it really just from December onwards. So we don't exactly know, whether or not it confers long-term immunity. I'll tell you what we do know, which is that other coronaviruses, like the ones that cause the common cold, those antibodies usually last about a year, and they do confer some level of protection to re-exposure from that same virus, and also actually to re-exposure from cousin viruses, so other types of coronaviruses. And we've seen the same with SARS, where the antibodies tend to last at least 2 years, and then the same for MERS, where the antibodies have lasted up to 3 years. So as best as we can tell, they probably do offer some degree of protection, at least in the short term, certainly for a few months, possibly even longer for a few years. But having said that, they have looked at some studies of patients who have been positive for the COVID infection, and they looked to see what types of antibody responses they mounted. And 70% of patients mounted a robust antibody response, 25% of patients mounted a low antibody response, and there were actually 5% of patients that had no antibody response despite infection to the virus. So if you get infected with the virus, the most likely outcome is that you will mount an antibody response that's pretty good. And most likely those antibodies will offer you protection, at least in the short term, probably up to a year or longer. But there is a possibility that you could, not mount that antibody response and therefore not have that type of immunity, or have a very low antibody response that doesn't confer the same type of protection. One of the questions in the scientific community that's being asked is whether or not the degree of antibody response is correlated to the degree of illness. So in other words, the ones that got sicker, do they have a more robust antibody response because their immune system had to fight harder than the ones that were asymptomatic or had very minimal symptoms? And that remains an outstanding question.
Yeah, and then on the flip side of that, someone asked, are you continuously contagious? Are you always contagious if you have the antibodies?
That's a great question, and the answer is no, definitely not. So the antibodies are just your immune system's marker of knowing how to fight the infection. It doesn't mean that you're actually giving off those viral particles in your respiratory droplets. So generally you're contagious with this for about 2 weeks or so. We have seen some case reports of viral particles being detected in people's respiratory secretions up to 4 weeks. So it's usually about 2 weeks, can be up to 4 weeks. We don't know if that 4-week mark where those viral particles were still present means that you were still infectious or not, but it's best to kind of be conservative and assume you were. But having the antibodies does not mean that you're actively infectious. It's sort of like, when you got your measles shot when you were a kid, you got your measles shot and your body made antibodies against the measles virus. You have those antibodies inside you all the time, but that doesn't mean you're actually infectious or a risk to others because of those antibodies.
I'm gonna let you guys go here in a moment. We're getting a few more questions, and if you have additional questions, you can post those into the comments. Dr. Fraser, this might be a good one for you to address as we talk about, as you guys are developing a test at at your lab, talk about, someone says they know of a drug testing place that says they have access to tests. They don't think that place is reliable. How does someone know if a place is going to be reliable for testing?
So, one of the easiest ways to start is to look at what kind of accreditation the labs have. So there's national organizations that do diagnostic laboratories, particularly one of them being CAP, is what we call it for short, of the College of Pathologists, and they accredit labs like mine. They come around and they check on us and make sure all of our stuff is in the right place and that our assays have been validated well. So that would be one of the ways to look at it, the lab itself. Now, the test that they are going to be administering, you want to look at if it's something that's on the FDA list. So, as part of this pandemic, we're really trying to get tests out as quickly as possible. So they've got what they call an emergency use authorization, or an EUA. So not very many of the antibody tests have that FDA certification yet, but they need to be on the list of tests that are asking for it from the FDA. So it's going to take a little research possibly to look at the lab to see if they're offering it to you. Are they a CAP laboratory? And if the test has been submitted to the FDA for clearance for what we call an EUA. So those are two things that if you see both of those, you've got a pretty good idea that we're looking at a test that's quality. I mean, and then just in general, is it some place that, is regularly doing healthcare? Are they a place, that is known for being able to do testing in general? If it's if it's a hospital that you're used to dealing with and they're offering the test, they will have vetted it before they're going to offer it to you. If it's a non-classic, non-healthcare place, I would be a little more, quite a bit more cautious.
And Dr. Dean, just in a follow-up to that, should we be worried about how quickly the FDA is approving some of these tests? She talked about an emergency approval.
Yeah, it's a good question. I think the FDA, even if they do things very quickly, does things very carefully. Certainly mistakes can be made, but they're taking a careful approach to making sure the tests have adequate data to support them, that they're really accurate as they say, and they're reproducible as they say. So, while certainly it's a concern, I think they're doing a great job in reviewing these tests and getting these things approved.
If I may add to that, the FDA is actually doing a joint effort right now with the CDC and a couple of other federal agencies to look at a number of these serology tests and compare them themselves. So, that data they hope to be able to communicate to all of us in a few weeks, and that'll be very helpful to healthcare providers, et cetera, to look at what tests perform well in that comparison. So, yes, they're having to speed things up because this pandemic is, happening now and we need the testing now, but they're trying to look at novel ways to make sure those tests are, of quality at the same time. But it's harder when you're rushing. So I think this comparison that they're looking at doing now is going to be very valuable.
Yeah, it's definitely a different world when it's, a pandemic and emergency situation. Sorry, Dr. Dean, did you want to add to that?
Yeah, sorry to interrupt, but I can chime in on that. Certainly there is an emergent crisis now that we want to get these tests to address. However, we also have to think in the long game, we really want very accurate tests, because I think it's very reasonable that we'll be thinking about this virus in months or years from now, and making sure we make the right steps now, make careful decisions on testing and what approvals are, so we'll be well positioned to manage this going forward.
Yeah, I think that's well said. Dr. Coley, someone just asked one last question. I'll pass it off to you. Someone said, how long can a person test positive once they're infected? If they had it in February, could they still test positive right now in April? We'll kind of just end on that last kind of coronavirus question, but I'll let you answer that.
So with respect to the nasal test, no. So that's only during active infection, remember. So once your symptoms are resolved and the virus is not replicating, that's negative. But with respect to the antibody test, as best as we can tell, based on how long the antibodies last for SARS and MERS, it goes up in about 7 to 10 days. So 7 to 10 days after infection, you start to see that rising. And then really a few weeks after, you get to steady state, or where it's going to be. And hopefully it sustains for several months, I would say. So from February to now, it's going to be probably still positive. But like I said, it may start to wane or go down as early as 1 year, as we see with some of the other coronaviruses. So really 7 days to 1 year kind of seems like a window for when the antibody is probably going to be positive. But at 2 months, it most certainly probably will.
Okay, I think we're going to wrap up here. And again, if anyone has any additional questions, you can post those in the comments and I'll pass them along to our experts. I want to thank everyone for joining me today. If you have other coronavirus questions or you need a medical question answered, you can also call the 9 Health Neighbors line. It's 303-698-4455, extension 2005. Leave a message with your question. A health professional, a 9 Health medical volunteer will call you back within 24 hours and answer that for you, a real person to talk to. Also, if you lost your job or your health insurance during this pandemic, I want to mention and remind everyone that Connect for Health Colorado's opened a special enrollment period. The deadline to apply for that is April 30th. Go to connectforhealthco.com to apply for that. And again, today we're talking about antibody testing. If you have questions, you can post those in the comments and we will get those answered for you if you have any after we end here. But again, it sounds like availability, will hopefully continue to go up. CU is working on a test that they're developing, so we'll hear from them soon, hopefully. And as Dr. Jean said, if you have had COVID, be on the lookout for some of the studies that you can assist with and help with so we can help develop some of these tests that we're going to be needing. So thank you everyone for joining us. I will let you go and we're signing off from here. Thanks so much.
Take care, everybody.